Hi, my name is Dr. Jane Hendricks. Are you a woman and entering into that age where your hormones start going crazy, the perimenopause? And that can last anywhere from 2 years to 10 years even. So we have got to find a way to make you feel better, right? You can't go 10 years with these crazy hormones. Mood swings, anxiety, not sleeping well, bloating, digestive problems, night sweats, some months, then no night sweats. It's just all over the place. And so as a naturopathic doctor, I've been treating hormones for 17 years. And what I work on is hormone metabolism. When you're in perimenopause, we have to look at the hormone metabolism. Any doctor can throw some hormones at you, but there's a couple things to consider here. How is your liver going to metabolize? Is anyone looking at that? Because if you're not going to metabolize, let's say, estrogen properly, you're going to gain weight around the middle. You're going to be bloated. You're going to retain a lot of fluid. Now, women don't mind. They notice with estrogen where they can kind of get some more fluid around their face. That's fine. But we don't want to overdo it and start swelling up around the middle or gaining weight. We all know that estrogen can have that issue. Progesterone also plays a role in water retention and digestive stuff. So we want to look at the metabolism of these hormones. Testosterone. A lot of women report hair loss up here on the top, but then hair growth on the face. What's causing that? And yet low libido and low energy and brain fog, that's testosterone deficiency, but then you have this hair issue. So throw testosterone at her, or, consider how she's metabolizing that testosterone, because that changes as well as we enter into perimenopause. You can start having these hormone fluctuations as early as mid-40s and go to your mid-50s before it's finally all over. And then the hormones can go down. And for anti-aging purposes, at that point, you'll probably want to get on some bioidentical hormone replacement therapy. We always look at family history, and we want to look at how you're metabolizing your hormones. Why? So I've mentioned the weight gain and the water retention. The long-term health consequences of just estrogen therapy without checking into your family history and the liver metabolism is that estrogen comes with long-term health consequences such as cancer. So we got to pay attention to that. I personally do not prescribe oral estrogen. I get just as good results with creams, and I'm not going to have to deal with this first pass liver, and which puts more risk with taking that long term. So I want my patient to enjoy the benefits of estrogen long term and not have to look over her shoulder and worry about cancer all the time. So we want that to be safe but effective, and these creams can be dosed in such a way as to really minimize the risk of estrogen and enhance the effectiveness. Progesterone is a big concern in perimenopause, something that every doctor should look at if you are treating hormones. That if you have a deficiency in progesterone, which is predominant in perimenopause, you'll have anxiety and you'll have trouble sleeping, insomnia. So especially the sleeping can be really disruptive. Then you're tired all the time, you have the brain fog. So it's very important to get a hold of this insomnia, and progesterone most of the time will take care of it. Of course, I do a full treatment program that includes diet, not eating certain things at night. You'll find that you sleep better when you avoid certain foods at night versus maybe earlier in the day. So it's a whole program, a whole anti-aging program that looks at what hormones you need, what genetic pathways in your liver need support, so that if you are going to go on hormone replacement therapy, you're going to break that estrogen down. You're going to metabolize that testosterone correctly so that you're not having more hair growth and acne, the unwanted side effects of testosterone, but to get the benefits such as the higher libido and the brain fog goes away. Testosterone therapy also helps to improve sleep along with progesterone. So these hormones are great. We want them, we need them, and we want to manage the metabolism of them so we can avoid both short-term side effects such as weight gain, hair growth in the face, not here. We want the hair growth there, but avoid the long-term health consequences such as the cancer. And so that is the important part about the way you test for hormones. I use a 24-hour urine test with Dutch labs. The reference values are a lot more specific to your age group. So when you, I don't know if you've looked at the ranges of your blood work with a normal lab, it is 20 to 200. Well, how are you going to know where you're supposed to be? It's too big of a range. So the Dutch test not only has appropriate ranges for your age, but they also look at what supplements you're taking, and they also have you fill out a symptom survey separate from my notes, so they actually get your feedback directly to them. So that's really important, because then they give you a thorough report on, hey, you look like it looks like you've got too much estrogen, the bad estrogen, not enough of the good. We suggest this supplement. So they even give supplement recommendations directly to the patient. Very scientific. So that is what my patients get if they're in perimenopause, so that I can give them hormones while protecting the side effects and long-term health consequences of the hormones, and getting the most out of those hormones. For more information on that, visit my website. I've got a page specifically for hormone replacement therapy. I do this by telemedicine or Zoom or in person at my office. If you have questions, if you've never seen a naturopath, feel free to fill out an online request requesting some information, and I can give you a 10-minute complimentary consultation to answer your questions about what it's like to see a naturopath. If you have questions about the lab, I can definitely get those answered, even send you a sample report to look at. So feel free to give my office a call or fill out that online form, and let's get you on the road to a more youthful life and better sleep, more energy, and smoother moods, and clearer skin, more hair. The list goes on. Thank you for listening.